My name is Elisha Li, and I currently attend Washington University in St. Louis. I became really attracted to WashU after listening to the director of curriculum speak at my undergraduate campus, actually. And so I found his educational philosophy really intriguing and very relatable. So I decided to do a little more research on the program. And so I found an open house that they're hosting. So I traveled to St. Louis and, I heard about the really unique curriculum there, and I spoke with lots of students and faculty members, and I really felt like the environment there was the ideal learning environment for me personally. And so that was probably like the number one thing. But also, I was really interested in the human movement system, which is like their main approach to physical therapy, which they pioneered themselves. And so I really wanted to learn from, those professionals that really paved that approach in physical therapy. Well, like I always knew I wanted to go into healthcare. I just didn't really know what field of healthcare. Obviously, it's really broad. I just knew that I really loved, like anatomy and learning about how the human body works. But I also really knew that I loved teaching and coaching. I had worked as a piano instructor and a cheerleading coach for a few years. And so I felt like I had a knack for working both individually with people and with groups of people and guiding them through something and working through something with them. So when I researched PT, I found that it really was like the perfect combination of, like health and coaching, like basically coaching someone back to health through movement. And then, of course, being a cheerleading coach, it really helped me with, visual appraisal skills and like watching movement and like movement cues and that sort of thing. So I feel like that all really helped with the field of physical therapy. But I feel like the thing that really solidified it for me when I was an undergrad, I volunteered and I interned at my school's disability resources gym. So while I was there, I was assigned to 1 to 2 students each semester. And so you're assigned to that one student or 2 students all semester, and you're there with them for their physical therapy sessions 1 or 2 times a week. So, I mean, because of that, I was with them for like 4 or 5 months. You really get to see, how they progress in their skills and how their outcomes change. And so I really love being able to spend so much time with them and develop really amazing relationships with those students. I still keep in touch with a lot of them today. So I feel like that really sold me on physical therapy. And plus my time there, I got to spend time with students with, like cerebral palsy and muscular dystrophy and spinal cord injuries. So it was a really amazing experience. Honestly, like right at this moment, it's kind of difficult. So like I'm not joking when we say we started this semester running. We just started week 2 of this semester yesterday, and I feel like it's already really challenging. We're doing like all upper extremity right now, and so I feel like the shoulders and everything. It's a very complex body part, but we're getting through. We have an exam next week. All of our exams are cumulative at my program, and we have them every 2 to 3 weeks. So I feel like the most difficult thing so far about school has been the pacing, like making sure I get all my work done, but also block enough time out to go back and study what we've already learned, since we are moving on such a fast schedule in terms of exams. But I do feel like that this format has really helped with my long-term retention. So there are pros and cons. I feel like my early clinical experiences have been a really big highlight for me. My program does this thing where once a week we go out to an assigned clinic where we're assigned to like a clinical instructor, and we really get to practice skills that we've been learning in lab on real patients. So for example, last semester, I was at an outpatient facility, and my CI was a chronic pain specialist. So I really got to learn a lot about pain science, and she had a very holistic way of approaching PT. So I learned a lot from her, and I got to practice skills, like MMT and visual appraisal, taking histories and vitals. Obviously it's really different when you're actually practicing with patients as opposed to your classmates. It's just like a whole different level. So that has been really amazing. And then also another thing that comes to mind is just we've had a lot of guest speakers at my program. I feel like my program is really well placed to be able to invite these amazing speakers in. Like we had the president of the American Academy of Sleep Medicine, and we had Dr. Ellen Jett, who was an APTA Macmillan lecturer, come and speak, and we've had like oncology specialists, diabetes specialists. So that's been really amazing. It really opens your eyes as to like how PT is involved in all of that and how interdisciplinary healthcare is becoming. So that's been really cool as well. Not really, no. I mean, back in undergrad, I thought I would be working more with the geriatric population. Like, I was really interested in like skilled nursing facilities and nursing homes. And then I got a taste of pediatrics while I was shadowing, and I really love that as well, which I know are like two completely opposite ends of the spectrum. But in terms of pediatrics, I was really interested in the creativity of pediatric therapy and, like the idea of play therapy. So I feel like teaching like I when I taught piano, I taught little kids, and so that would have been really conductive to that, and also just like cheerleading coaching in general. So I was like, maybe I'll be better suited to that, but I don't know. We're just kind of all over the place right now. Hopefully it'll narrow down in the next 2 years. I feel like my program is relatively diverse. In terms of the numbers, I think it's about 40% of my class is Black, Indigenous, or a person of color, which, that number sounds great, but it's not all about the numbers, obviously. My program hired their first director of diversity, equity, and inclusion this year. So that's, a step forward. They've been really working to create an atmosphere that celebrates everyone's differences in life experiences. And I feel like the faculty have really welcomed and encouraged us to share our experiences in lectures when it's relevant to the topic. So that's been really good. Um, and then, diversity, equity, and inclusion is what they call a thread in our program. So it's like a reoccurring topic, and we constantly have lectures on it. My lecture right after this is actually race and ethnicity in healthcare. So it's really great that they're incorporating that into our program, and they're really emphasizing it. In terms of my program, I feel like they've done an okay job of, diversifying the cohorts, but I feel like I'd like to see more diversity among the faculty and staff. I really love all my professors, and they're really amazing, really encouraging, really great professionals, but there is pretty limited diversity on the staff. And so I feel like hopefully in the next few years, they'll consider, diversifying. But of course, I feel like that also has to do with the lack of diversity in the PT field from the past year. So hopefully, as we enter like, the next generation of professors and people in academia, it will diversify a little more. So I feel like PT is definitely an investment in terms of the schooling, but if you are passionate about the field, you'll really love what you are learning. I mean, in the 2 or 3 years that you're in school, you really become an expert on the human body and how the human body moves, like literally a movement expert according to the APTA. I mean, I just feel like there's little as fascinating as like what the human body is capable of. So I feel like if that's something that sounds interesting to you or to students, like do a little soul searching and shadowing and reflecting, and figure out what PTs can do, and just like know that the field can take you like so many different paths and directions, and there are a lot of options. So it's something I would recommend. The biggest piece of advice I would give is to know the research behind education and long-term retention. There's like a lot of literature out there now about strategies like active recall and spaced repetition and feedback processes and other learning tools that I think are invaluable to a student's learning process. And so I feel like, for example, the director of curriculum at my program before the semester started, or before last semester started, he sent out a reading recommendation, and it was a book called Make It Stick, and it was full of basically learning science research and different tools that both students and educators can use to really enhance learning. And they've really implemented a lot of those strategies in our curriculum. So I feel like that has been really beneficial to my learning. And so for like all educators and even students out there. I feel like knowing that research behind that is really valuable to making like long-term clinicians and students. I feel like PT will evolve to become more of a prevention field just as much as it is like a care field like we are now. I feel like as PTs, we're placed in an incredible position to not only treat people, but be able to help prevent injuries and illnesses in the first place. Like we can teach people how to move better and screen for movement deficiencies, educate people on prehab exercises to prevent harm to their bodies, and to prevent, things from occurring later on so that they don't have to get surgeries and then come to PT afterwards. But I also feel like with that comes like an emphasis on social determinants of health, targeting the populations who are more likely to have those poor outcomes and really targeting those prevention techniques on them, and help bridge that gap. So hopefully I feel like that's where PT will move in the future. So the director of the PT program actually sent out an email the very first week of PT school. It was literally like days before the deadline though. So I was like, oh, I don't know if I'll apply. But then I read through Rising Tide's website and, all like the resources they had on there and the blog posts. And I knew that it was, an opportunity that I really had to try for because I knew the foundation would be one that a lot of people would dream of being a part of and their mission was really important. So. I completed the initial application. It was kind of up in the air. I wasn't sure if I was going to receive an interview. Like I said, I had just received the application a couple days before the deadline, so I didn't spend as much time on it as I wish I could have. But, luckily I had professors and mentors from undergrad that were very willing to help me and vouch for me and, write my letters of recommendation really quickly. And then, luckily I was given an interview. Before that, I was like literally shaking with nerves. I had just like finished my work study in the morning and then I like ran up to the top floor of my PT program. And I found a study room to do the Zoom call in. And obviously I'd, read up on the Trailblazers beforehand. So it was very intimidating being interviewed by so many of them because they're really amazing industry like leaders and professionals. So I just remember being like kind of awestruck and very nervous. Otherwise the interview is kind of a blur. I don't really remember like what I was asked or anything, but I just remember thinking it went, like pretty well. And then I found out that I was generously awarded the scholarship a couple weeks later, like pretty late at night, like right as I was like getting into bed, and I freaked out and I called my mom and she was super proud and really emotional. So that was really sweet. I mean, I'm obviously very grateful to Rising Tide, for their generosity. Obviously the scholarship offers a lot of financial relief. If I have more breathing room, it feels like a burden has been lifted off my shoulders. But not only that, I feel like being selected as a CREST scholar, it gives me more motivation to, work even harder and make the selection committee really proud. They've obviously made an investment in me, so I really want to represent both myself and my program to the best of my ability. So it kind of lights a fire under my butt. Honestly, like I'm really looking forward to seeing like what kind of waves the Rising Tide Foundation will make as an up and coming foundation. I've been keeping up, with their blog posts and the updates on social media and LinkedIn. So I'm excited to be part of such a strong and diverse community. It's really important. And there's so many mentors and trailblazers in the PT field that are involved in the foundation. So that's really exciting. So I'm excited to see like where those relationships can take me and just like watching this foundation push, diversity, equity, and inclusion. But also just like in the next year, I'm really looking forward to seeing like when we'll have more CREST scholars selected and we can really start forming that like mentorship and networking web of PT students from around the country. I think that'll be really exciting. Yeah, I mean, it's obviously incredibly important. We already know from research that certain communities are disproportionately affected by poor health outcomes. And, some people have really heavy barriers that lead to decreased access to care. So I feel like having a diverse workforce really leads to having providers that are more readily able to, respond to a patient's cultural needs and expectations. Um, I mean, not only that, but I feel like just like as someone working with a diverse workforce, like that in and of itself, like working with people with different backgrounds than your own, can help frame your own perspective and really helps you develop the cultural competence skills and cultural humility skills. Honestly, when I think of the patient perspective, my mind just like instantly goes to my dad. So a few years ago, my dad was involved in a car accident and he required care from a neurologist and a physical therapist. But he traveled over an hour to get care from a physical therapist and a neurologist just because he really wanted providers who were Chinese, or at least he could have like an in-person translator with him so he could feel like he could more readily participate or ask questions. Like he didn't want to feel like he was hindered by language barriers. And there's nowhere around like the area where I live in. I'm from like a pretty small town, with like those kind of resources. And so I feel like that just goes to show like he was willing to travel over an hour for that kind of care. So it just shows how much people care about having like culturally competent care and how much they're willing to spend, like not just money spent, but like time spent to get that kind of care. And get that kind of diverse provider. He found really like great providers that he really loves. He still goes to them now, even just for his like primary care now. So like before, I was talking about the idea of PT moving into more of a prevention aspect. So my mind is obviously really focused on patient care right now, just because that's a lot of what I'm learning in school. So I would really like to integrate my program's human movement system approach to therapy and apply that to topics of prevention. And perhaps combine that with my love of like community service, my commitment to community service, to provide maybe pro bono work in the future. My program's actually starting up a pro bono clinic this semester, so that's really exciting. But really just helping people move their bodies in an efficient and healthy way so that they can live injury-free and healthier longer. But then, also I've thought about in the long-term future, like several years down the line, I've thought about like maybe going into academia because I do enjoy that teaching aspect. So I would love to add, to the diversity of academia. But we'll see where that takes me. But just, overall, I hope to grow into a more culturally competent and culturally humble provider who can, make all of my patients feel comfortable and at ease. I feel like that's my biggest goal right now.